Hi, my name is Chelsea Harrison. I'm the nurse, and this is my little patient, Kinley. She's going to be my volunteer for a head-to-toe physical assessment today. Prior to the assessment, I had Kinley empty her bladder. We checked her vital signs. We weighed her and measured her. And we also did a Snellen eye exam, both nearsighted and farsighted, and everything is checked out. I also asked Kinley a full medical history, including her immunizations, recent hospitalizations, any medical conditions, what current medications she's taking, what allergies she has, when the last time she's been to the doctor, along with a full family history and a full head-to-toe assessment of questions such as, do you have any seizures, have you had any history of stroke, any thyroid problems, any heart conditions, lung conditions, any musculoskeletal, or any gastrointestinal issues. Now we're going to start our head-to-toe physical assessment, and I'm going to start by just looking at Kinley from the front. I'm looking at her head. I'm notating that there's symmetry. I'm looking to make sure that there's no lumps, lesions, or bumps. I'm just going to palpate your head for a minute. Tell me if you feel any tenderness. I'm palpating for lumps, lesions, or bumps, and tenderness. Go ahead and look straight forward at me. I'm going to do the same thing for your face. I'm just palpating for tenderness, notating your sinuses. You don't feel any pain or any tenderness there?
No, ma'am.
Going to palpate around your occipital bone. No tenderness?
No tenderness.
Okay. I'm also going to do the same with your ears. I'm looking first to make sure that they're symmetrical. I'm going to also take palpate the pinna. Do you feel any tenderness on that ear? Any tenderness on this ear?
No.
I'm going to also look behind the ear at the mastoid process, notating that there's no lumps or lesions. Any redness or discoloration of the skin? Okay, look straight forward at me. I'm looking at your nose. I'm looking at it symmetrical, that it's midline, that there's no notable deviations. I'm also going to come down and palpate around the mouth. No tenderness. I'm going to do your submandibular joint here. Can you open your mouth for me? Close your mouth. Okay, open it back up and move your bottom side to side. No pain there. I don't feel any popping or any evidence of TMJ. Okay, can you open your mouth for me? What I'm looking for here is notating the color, looking for any cracks, any bleeding, any coating on the skin, any coating on the tongue. Can you stick your tongue out and say ah? I'm looking at the uvula, looking at her tonsils and her pharynx. Also noting the back of her throat that there's no drainage, no redness or irritation. Looking at the color inside of her mouth. Stick your tongue back in. Notating that there's no dental caries or discolorations. Looking at the hard and soft palates. While your mouth is open, I'm going to shine a light through your sinuses. Open your mouth just to make sure that the light shines through. That tells me that there is no masses or blockages in her sinuses. Okay, can you stick your tongue out for me? Now raise your tongue up. Move it side to side. Okay, that is checking a cranial nerve and it is intact. You can close your mouth for me. While I have you in here with the light, I'm going to look up your nose. What I'm looking for is discolorations. Notice that there's no deviations and that there's no drainage. Okay, perfect. Okay, I want you to look straight at me. Actually find a spot on the wall behind me and don't move your head. I'm going to come in and shine this light right in your eyes, okay? What I'm looking for is the direct response to the pupil and the indirect response. And the direct response along with the indirect response. What I was looking for there is your pupils to react to the light and it to be symmetrical on both sides. Okay, I want you to look straight at me and I'm going to check to see where you can see my fingers. I'm going to start way out. Tell me when you can see my hands.
No.
When you can see my hand.
No.
Other
No.
side.
No.
Other side. Okay, I want you to look straight at me and we'll check your cardinal fields of gaze. So follow my fingers without moving your head. Perfect. All right, looking straight at me, I want you to raise your eyebrows up and down. Close your eyes real tight. Open them up. Open your mouth real big. Clench your teeth. Puff out your cheeks. Okay, let it out. Smile and frown. Okay, that is checking cranial nerves and they're all intact. While you're here, I want you to also raise up your shoulders and shrug them back down. Okay, we're going to check the range of motion in your neck. If you can just bend this way and then this way, all the way back and all the way forward. Okay, perfect. You don't have any pain or tenderness when you're moving your head around? Okay, I'm just going to palpate on your neck. Tell me if you feel any pain or tenderness. Okay, I'm just going to look at your trachea and make sure that it is midline. And I'm also just going to look and feel for the thyroid. And it's there. While I'm here, I'm also going to feel for her carotid arteries. Make sure that they're regular rhythm, that there's no palpitations. Also on this side, that the rate is regular and there's no palpitations. And I don't feel any. Okay, while I am here in your face, I'm going to go ahead and do an assessment of the inside of your ear. Okay, I'm just going to pull up on your ear just a little bit. I'm going to look in your ear. What I'm notating is that there's no drainage, that your tympanic membrane is clear, a pearly translucent gray, that there's no redness and no signs of symptoms of infection. Okay, and do the same with the other ear. Just pull up on that ear a little bit, go in. I don't see any redness or irritation, no bumps or lesions. Also the same with the tympanic membrane, is a translucent pearly gray, no redness, no signs of symptoms of infection. Okay, I'm going to use my Snellen eye chart to test for conversion. So what I want you to do is just read me a line. We're not testing for your vision, so you don't have to cover your eyes. I'm actually looking to see how your pupils react. So if you can read me those three letters right there.
F-P-H.
Okay, what I was doing is making sure that her pupils responded the same in a symmetrical pattern to the reading. Okay, I also am going to do what is called a whisper test. So I'm going to go a little bit behind you and I'm going to whisper a word and I want you to tell me if you can hear it. Okay, I'm going to do it this way. I'm going to come behind you. What word did I say?
Purple.
Purple. Let's test the other side.
Orange.
Perfect. Okay, while we're testing hearing, this is called a tuning fork. What I'm going to do is I'm going to strike the tuning fork and I'm going to place it on the top of your head and I want you to tell me when you stop hearing the sound, okay?
Now.
Okay, now I'm going to strike it again. I'm going to put it right behind your ear on the mastoid process. Same thing. Tell me when you stop hearing the sound.
Now.
And tell me when you stop hearing the sound.
Now.
Okay, we'll do the same thing on the other side.
Now. Now.
And what that is doing is testing the bone versus air conduction, which was good. Okay, now I'm going to move on down off of your face and we're going to look at your arms. And what I'm doing is I'm looking to see if there's any bumps, lesions, that there's no rashes, that your skin is nice and healthy, there's no dryness noted. Go ahead and feel for your brachial artery while I'm here. I'm just notating the rhythm, that it's not hyper or hypoactive. No tachycardia or bradycardia noted. The rhythm is good. Same on the other arm. Just notating that there's no rashes, that the skin is not dry, and it's moist. I'm going to go ahead and feel for that brachial artery and that radial artery. Okay, while I'm here, I'm going to check your fingernails. I'm looking at your nail beds to make sure that there's no blue coloration, which is cyanotic, which would indicate poor oxygen flow to your hand. I'm also going to check for the capillary refill, which it should be less than 3 seconds, and it is. I'm going to check on this side. It's the same, should be less than 3 seconds, and it is. Okay, I'm going to start by looking at your chest. I want you to take a big deep breath in. I'm just notating that it's equal and symmetrical on both sides. You can blow out. I'm looking to make sure that there's no lumps, lesions, or bruises, that there's no rashes, nothing notated on there. Okay, I'm going to actually listen to your lungs. I'm going to listen to the front and the back. If you could just take some deep breaths for me. I'm just going to go side to side in a symmetrical fashion. What I'm doing is notating that the sound is the same on both sides. That I don't notice any crackles, any wheezing, any rhonchi, any dullness that might indicate fluid buildup. Okay, same on your back. Same thing again, it's a side-to-side symmetrical pattern. Okay, if you can put your hand straight out for me, I'm also going to just hand straight out. I'm just going to listen to the lateral aspects of the lungs. And this side. Back on this side. Same thing here. It's side to side in a symmetrical pattern. Just notating that the sound is the same, that I don't notice any dullness, any diminished lung sounds, breath sounds. There's no crackles or wheezing. Okay, perfect. So now what I'm going to do is I'm going to percuss your lungs. Well, all it calls for is me placing my fingers on you, and I'm going to do a little tapping sound. What I'm doing is I'm listening for any changes in sound, any dullness or any hyperresonance that may indicate fluid buildup. Okay, perfect. Do the same thing on the back. It's very important here also that you go side to side in a symmetrical fashion. That's so that you can compare each side to the other, because the sound may change as you go down the lungs, but shouldn't from side to side. Okay, while I'm back here, I'm also going to percuss to hear your diaphoretic excursion. So what I want you to do is take a big deep breath in and hold it. Okay, let it out and keep it out. What I did is I marked at the level that the sound changed when she breathed in, and when she held it, and when she had all the air blown out. And both are here, and it should be about 3 to 5 centimeters apart, which hers is, and that is good for her. Okay, Miss Kinley, I'm going to have you scoot up a little bit and lay down on the bed, and we're going to do an assessment of your belly. So I'm going to raise your shirt up just a little bit. Okay, what I'm first doing is I'm just looking at your skin. I'm notating that there is no rashes, no visible lesions or masses. Okay, and very important that on the assessment of the belly that you start by listening to it. So I'm going to listen to all 4 quadrants. What I'm doing here is I'm listening for your bowel sounds, and you may have to listen for up to 2 minutes on each side until you hear the bowel sounds. You're listening for the gurgling noise, and I just want to make sure that they're not hypo or hyper. And all 4 here. Okay, here I'm going to turn to the bell of my stethoscope, and I'm going to listen to your aortic artery. I'm notating the rhythm and the sound, and noting that there's no bruit. Listening now to your renal artery, your left renal artery, your right inguinal artery, your left inguinal artery, your right femoral artery, and your left femoral artery. And there was no bruising or thrills heard through all, which is great. Okay, now what I'm going to do is I'm going to just do that same little tapping motion I was doing to your lungs called percussing. I'm going to go up here until I hit a sound where it changes, and that's going to be the lower border of your liver, which is there. Also percuss back down. Okay, I'm going to percuss your spleen, but in order to do so, I need you to turn a little bit on your side. It's normally a little bit easier to hear the spleen when you're on the side. Okay, good. You can turn back over. I'm going to start by doing a little, I'm just going to do a general percuss over your belly, just to see if there's any changes in sound, which might indicate a mass or fluid buildup, like ascites. And I don't hear any changes throughout. Okay, so I'm going to start with a little light palpation. We're just going to rub in your stomach a little. What I'm doing is I'm trying to feel the lower liver border, which I can feel there. I'm going to try to feel your spleen, which I should not be able to feel, and if I could feel your spleen, that would indicate some kind of enlargement. Okay, just going to palpate over your whole belly to see if I feel any hernias, any masses, any area of tenderness or pain. Okay, and I'm going to do a little bit deeper now. This is to actually feel for your organs, and I can feel that liver there. Good. I also should not really be able to feel that spleen, even with a deep palpation. Any pain, any tenderness. I don't notate any masses or any hernias. While we're on the subject of hernias, can you lift your head forward just a little bit? If she had a hernia, this would be a good position for the hernia to pop out. You can lay back down for me. Okay, your abdomen looks great. If you can go ahead and turn your little legs out to the side, and we're going to sit up. Okay, I'm going to go down and look at your legs. And I'm just going to notate the color of them, that there's no rashes, there's no soreness, no tenderness. I'm looking at your feet. I don't notice any swelling. Looking at the capillary refill in your toes. Those are great. All great. Going to feel for the arteries now. I got the popliteal, the tibial, and pedal pulses. Same thing on the other. Popliteal behind the knee, the tibial, and the popliteal. And those are all great. Okay, we can check your reflexes now. I'll start with your legs since I'm down here. So we're going to start, just dangle your leg for me. And we wanted to notice a slight flexion, which we did. And on the other, perfect. Now I'm going to flex your little foot just forward, and I'm going to strike your Achilles tendon. Great, and I did notice a little flexion. And again on the other side, great flexion. Okay, while we're checking reflexes, let's check your arms. I'm going to pull your shirt up just a little bit, and we'll check the reflexes in your arms. So we'll start with the brachial reflex. Great. And the radial reflex. That one's good and intact. Going to go to the other arm. Brachial and radial. Perfect. Okay, now that I'm done assessing your body here, I'm going to have you stand up. We're just going to look at the musculoskeletal system. Have you turn to the side here and bend forward just a little bit. So I'm looking at your spine, noting that there's no curvature, that there's no tenderness. That's even and symmetrical on both sides. Okay, you can turn back and look at me. Looking at the collarbones and the shoulders, making sure that they're even, and the hip bones, which would all indicate possible scoliosis. Can you put your arms out to the side for me? Okay, I'm going to push my hands down, and I want you to push up against them. Perfect, and do the opposite. Great. Now come out straight in front of you, and we're going to do that same thing. Push up against my hands, and push down against my hands. Okay, great. All right, you can sit down. Now I'm going to ask you a couple of questions that you may think are silly or that obvious questions. First thing I'm going to do is I'm going to tell you 3 words, and I want you to remember these words, and I'm going to ask you what they are later. Okay? First word is going to be pink. Second word, banana. Last word, shoe. Okay? Now can you tell me what your name is?
Kinley.
Can you tell me how old you are?
6.
Can you tell me what year this is?
2017.
Perfect. Can you tell me who the president is?
Donald Trump.
Okay, good. Do you have any problems with blurry vision or dizziness, feeling like you're spinning? Any problems with headaches? No? You never had any diagnosis of a stroke or heard the term of CVA or TIA? Nothing like that. Okay. Can you tell me what those 3 words were that I told you earlier?
Pink, banana, and shoe.
Perfect. Do you have any problems with concentration at school or any problems with anxiety where you feel really stressed? Any feeling of sadness or depression? No? Okay, well, you've completed your physical assessment, and I want to thank Kinley for being my volunteer, and thank you for watching.